Good afternoon, one and all. I'm going to talk on impact of online vision therapy on functional vision of children with multiple disabilities. Financial disclosure. According to Intellectual Disabilities Education Act, multiple disabilities is defined as concomitant impairments, a combination of which causes severe educational problem that they cannot be accommodated in a special education program solely designed for one of the impairments. Impairment of functional vision has impact over motor competencies, cognitive and social aspects of human life, and prevalence of such impairment in children with multiple disabilities is about 10.5%. Continuous rehabilitative support is needed for sustained development and to curb the potential delay in the global development of children with multiple disabilities. But during COVID, only essential services and emergency services were available. The travel restrictions were imposed and rehabilitative services were not part of essential services, because of which the children with multiple disabilities had regression in their sensory and motor skill development, showed increased behavioral problems, and parents had added responsibility of providing rehabilitative support without any professional help. So during the second wave of pandemic, due to increased parental concern, online vision therapy was started. The aim and objectives of the study was to analyze the transition in functional vision, that is grating visual acuity and contrast sensitivity during in-office vision therapy, no therapy period, and online vision therapy, and also to study the adequacy, effectiveness, and impact of online vision therapy as perceived by their parents. This was a retrospective observational study done on 15 children with multiple disabilities at Department of Vision Rehabilitation Center in a tertiary eye care setup based in South India. Children with multiple disabilities who were previously enrolled for in-office vision therapy, who are on regular follow-up and subsequently adopted online vision therapy and completed 25 sessions, that is 6 months of online vision therapy, were included. And those children who were not previously enrolled for in-office vision therapy, who did not complete regular follow-up due to other medical illness, and children who did not complete 6 months of online vision therapy, and those parents who did not show willingness for this online therapy and who had difficulty in accessing the platform, e-platform, were excluded. So methodology included complete comprehensive eye examination by pediatric ophthalmologist, following by functional vision assessment, that is contrast sensitivity by hiding Heidi chart, and grating functional assessment by means of LIA grating paddles, and this was used for baseline vision assessment as well as the post-therapy session. After which the online vision therapy was conducted using Zoom platform, and before any session there was a pre-session where the special educator would contact the child's parents and would brief about the next day's session. The feeding time, the sleeping time of the children will be noted. The availability of the material and support will also be noted. During the session, if the children was verbal, the special educator would communicate with the children directly or otherwise with their mother or with the other parents. Then each therapy session will lasted for about 45 minutes, during which, based on the rehabilitative strategies planned for each and every child, the rehabilitation therapy was given. After the online vision therapy, a person who was not involved in the rehabilitation service was collecting the response of the patient for their satisfaction level, which the questionnaire was administered by an oral interview. So these are the results. This is a table showing the grating visual acuity changes during pandemic. So before the first lockdown, the median visual acuity was about 1.5 cycles per degree, which regressed to 0.9 cycles per degree during the first wave of pandemic, which was statistically significant regression. And when in-office therapy was restarted once the travel restrictions were lifted off, it showed a statistically significant improvement. And then when during the second wave of pandemic, when online vision therapy was given, it showed that the grating visual acuity was maintained, that there was no statistically significant regression. So this is the contrast sensitivity changes. Here, the 12 children were under testable category when before pandemic, and then during pandemic, since there was no intervention, it regressed to about 9 children who were under testable category. 3 children regressed to non-testable category, and then after restrictions were lifted off during in-office vision therapy, 4 children improved and 13 children became testable. And during online vision therapy, that is during the second lockdown, it was maintained. And these 2 children, they continued to be in the non-testable category because of profound PL vision. So any deterioration either in the contrast sensitivity or in the grating visual acuity will be taken as a deterioration in the functional vision. So plotting that in a graph, about 11 children showed worsening of functional vision without any intervention, and during in-office as well as online vision therapy, the children showed either improvement or maintenance of functional vision. So these were the questionnaires which were administered to assess the satisfaction level among the parents. Majority responded in affirmative. And few parents, they had issues of lack of family support. So majority showed regression without any intervention, and this was also supported by T. Battiston et al., who did a similar study to study the satisfaction level among parents and showed high satisfaction level. And these were the advantages and shortcomings. Mainly, the advantages was the safety level, the accessibility. It eliminated the waiting time for the patient, especially for children with seizures. And the shortcomings were this could not be applicable for children with profound PL vision, and this does not match the special bond between the special educator and the children with multiple disabilities. And to conclude, though this is not a replacement, online vision therapy can always be implemented along with in-office vision therapy whenever it's needed, and does not have any compromise on functional vision, and also has high satisfaction level among parents. Thank you.
So it's a good discovery during pandemic, as we have discovered that we can continue our webinars and without any without meeting each other. So yes, it's a good fallout of the pandemic.
Yes.